Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, World TB Day is celebrated every 24th day of March, and with this year's theme being Invest to End TB, Save Lives. However, around the world, 4,100 people die every day, while 30,000 others contract the disease, despite it being preventable and treatable. So why is this the case, and what can be done to prevent the same? We find out after these facts of the matter. Tuberculosis is an infectious disease that mainly affects the lungs. The bacteria that causes TB is spread when an infected person coughs or sneezes. People infected with TB bacteria have a 5 to 10% lifetime risk of falling ill with the disease. Those with compromised immune systems, such as persons living with HIV, malnutrition or diabetes, or people who use tobacco, have a higher risk of falling ill.
Niliaguziwa na TB 2020. Nilijisikia na kohoa, joto mingi mwilini. Nilikuwa naenda na nunua chest cough, but naziko nisaidia. Hapo ndo niliamua niende usi. Walinipatia sachet fulani, nikakohoa. Wakabaki na kikohozi. Wakaniambia wataipeleka kwa lab. Kaenda wakapima, wakaniambia niko na TB na naanza matibabu. Na nikaanza kumeza madawa. Nikameza madawa for about 4 months. Nikajisikia niko poa. Nikaacha kumeza madawa. Tena baada ya 4 months nikajisikia ile hali imerudi. Nikadecide acha nirudi huko. Nilianza madawa fresh. Singeweza sawa cause mimi unajua job nafanya job ya bodaboda. So sasa nakuaga niko tu hapa. Na nikameza for 6 months. Nikajisikia niko poa. Mpaka sasa hivi saa hizi. Nilimaliza kumeza madawa last year. Nilipomaliza madawa nilirudi usi. Nikaenda nikapatiwa tena sachet. Nikaambiwa kohoa. Kakohoa. Kikohozi kapelekwa kwa lab. Kaniambia utanipigia simu, akaniambia uko sawa. Kwa hiyo nilikuwa silipi chochote. Nilikuwa napatiwa dawa for free. Mawaidha yenye naweza ambia mtu yeyote mwenye atajisikia kuna hizo hali ya joto mingi mwilini na nakohoa, asiogope, ende usitu na atameza madawa na atapona. Na sasa hizi najisikia niko poa, niko na nguvu, hata job napiga poa.
All right, let's get to understand more about TB and what you can do in the event that maybe you are diagnosed with the same, so that, again, reduce cases of stigma around the same. And, of course, to help us with the discussion, we have Dr. Stephen Wanjala, who's a public health specialist from Center for Health Solutions. Thank you very much for joining us today. And we also have Vivian Faith, who is a TB advocate. Again, thank you very much for joining us, Vivian. So let's begin with you, Dr. Stephen. When we talk about TB or tuberculosis, we hear this a lot, but then again, the intensity or the magnitude of the same sometimes can be a little bit of a gray area for so many people. So TB, what exactly is it?
So TB is an infectious disease that's caused by bacteria called Mycobacterium tuberculosis, and it can affect literally any part of the body except maybe the nails, your teeth, and your hair. But everything else can be affected by TB. Yeah, common myth is that it affects only the lungs, which is what many people think. And that is actually the most common form, but it can affect any part of the body.
All right, so when it comes to then the TB burden in the country, where are we at?
So the WHO estimates that we have about 140,000 new cases every year as a country. But we managed to diagnose just about half of that. So a big gap that we have as a country is that we are not getting the cases. And partly is because maybe people are not seeking services or not seeking services at the right places. And as a country, we are estimated to lose about 33,000 people every year. I think it's important for us to remember those figures, even if they sound a bit grim. because I think that is a good call for action for us to move to reduce those deaths.
For you, Vivian, you were diagnosed with TB in 2018. You told me at first you were like, no, this is not the case. And, you know, you had like cases of self-stigma, right? Can we just go back to 2018, that very day that you were told, well, this could be TB?
I was in denial at first. I never accepted the treatment at first. So before even doing that, at first I was going over counters, getting some other medication because I wouldn't believe that I had tuberculosis by that time. So I got the pneumonia medications, and I went back at home. I took them for maybe roughly just 2 days, and I let go of the drugs. Then I went over counter again when my health was deteriorating. I went for some other different medications again. I brought them back to the house, and still I never took the medications. So when my health really deteriorated, I had to go back to the facility where I was by that time, and I explained to the doctor. And that is when he told me, okay, why don't you just do a sputum test and let us confirm whether it's tuberculosis. And that is when they found out it was TB. Yeah, so that is when I was given the TB medication, and I went back at home with them.
Okay.
But funny enough, I never took the medications for some time.
How long?
2 months. I'd go pick the medication, come back, wait for the next TCA to go back to the facility. I throw the medications back to the team.
Okay. Isn't that dangerous? Because, Dr. Steven, because number one, what she says is, number one, of course, she was in denial, like almost everyone else, but then again, taking the wrong medication for the wrong disease, right? Does that maybe exacerbate the condition, especially for TB?
A study that was done by the TB program showed TB patients on average, they'll have gone to a facility 4 to 6 times before they get diagnosed. Very often it's over the counter to buy medications, very frequently treated for pneumonia several times before we actually get the right diagnosis.
Okay.
Now, why that's important is that the longer you delay treatment, the more likely you are to have poor outcomes. And poor outcomes here, the worst of them is death.
Yeah.
Then the second question he asked, does that for TB increase make it worse?
Worse, yes.
Yeah, so there are some medications which partly work for TB and they are used for pneumonia. So what happens for the patient is that they might feel a little better. And because of that, they might even doubt the diagnosis and think, but this seems to be working because the symptoms get just a bit better. And then after some time, the symptoms come back. But what might be happening is that they might be developing a form of drug-resistant TB, which is much more difficult to deal with.
And so for you, Vivian, again, where would you say you got it from?
There was a facility I was volunteering at first, and I was just dealing with tuberculosis. So I can't say whether I got it there. I just don't know where I got it actually.
Okay. So how were you feeling before you even went to the hospital to maybe seek to understand what was going on in your body?
Okay, so I was weak. I was very weakly. I couldn't even do some stuffs on my own. I had to call for help at times. I was coughing and I had night sweats. I would wake up in the morning, I would find where I was sleeping, it was just wet. Yeah.
Okay. All right. And then, Dr. of course, someone would ask, so then how is TB spread exactly?
It's transmitted through droplets. So somebody who has the form of TB that affects the lungs, that's pulmonary TB, when they cough, they release droplets which have the bacteria, and these remain suspended in the air for up to 6 hours. And when we come here and breathe in and out, then the bacteria seed in our lungs, and they may develop into a disease, so they might actually take on and start multiplying and develop into an infection, or they might be remain dormant, something that we call latent TB.
So how long then can it stay dormant?
So latent TB can stay with you for the whole of your lifetime, and you might not ever develop into active TB. So generally between 5 to 10% of the people with latent TB over their lifetime will develop active TB. So at some point, if your immunity goes down a little bit, then there's a breakthrough in the infection in your body, and now they start multiplying much more actively, and then you end up with active tuberculosis.
Yeah. Okay. And then there's so many myths surrounding tuberculosis. Can we just go through them very quickly?
So I think in our country, it's important to start with the fact that anyone with TB has HIV, because very frequently people see you have TB and they think, then you must have HIV, which is completely false. Only less than 25% of our patients with TB have HIV. The other one is that TB always leads to death, I think, but Vivian being present here is testament that treatment works.
Exactly.
Treatment works, and treatment is freely available in all government facilities. And I think an important other myth is that there's only active TB. So it's important to remember that there's latent TB. And there's also some medication that you can take to clear your body of latent TB, which we call TB preventive therapy.
As TB and HIV and AIDS is concerned, because we all know TB is a leading cause of mortality and morbidity amongst persons living with HIV and AIDS, right? What would you say as far as then just making sure, protect yourself maybe from contracting TB or, you know, the worst form or the worst symptom of the same?
Yeah, so I think I'll start by saying the country has a policy which is helping to reduce the burden of TB amongst HIV positive people or persons living with HIV, let me say that. That every year, they actually not even every year, and every contact with a health facility, they're supposed to be screened. And by screening is being asked questions around, do you have cough? Do you have a fever? Do you have any symptoms that suggest that you have TB? And if that symptom screening is positive, then they directed to additional testing to establish whether they have. And so for persons living with HIV is to just understand that every time they go to a facility, they should, if they have any symptoms suggestive of TB, they should express this to their healthcare worker. One symptom I have to mention that is, or sign that is missed very often, this gradual, slow but steady weight loss is often the first sign that something's wrong.
All right. So Vivian, you told me earlier on that you also had cases of self-stigma from the same.
I would choose to close myself, just to be by myself and not include anybody in my life. But later on, after I had started adhering to my medication, I had to bring in some of my friends to assist me in some things, and I needed also that support. Some left, I was left alone. Yeah. Some few chosen friends who agreed to stay with me, stayed with me. Yeah.
And when you were told that you had TB, were you scared at first?
Yes, I was scared.
All right, so let's take a short break. But of course, when we come back, we'd want to understand. So fine, at what point did you decide to start taking medication? Because like you said, 2 months in, you never took any of the medication. And then also for Daktari, in terms of the difference and the similarities of between TB and COVID-19 as well, we'd also want to understand that. You do not want to miss part B of this conversation. Stay with us. All right, welcome back. This is Health Diary, and in case you're joining us right now today, our focus is on tuberculosis. And to help us with the discussion, we have Dr. Stephen Wanjala, who is a public health specialist from the Center for Health Solutions, and we also have Vivian Faith, who is a TB advocate. Thank you very much for coming today, and of course help us with the discussion. So Dr. we'll just go quickly through the difference and the similarities between TB and now that we have COVID-19 pandemic in the country, not in the country, across the globe. Yeah.
Both of them have, they share symptoms. Okay. So they share the symptom of cough, they share the symptom of fever, symptoms of fatigue, sometimes also the symptoms of difficulty in breathing. The differences are mainly that TB usually has a longer course, a slowly progressive and longer course than COVID, which typically has a faster progression and a shorter course.
Okay. Yeah. And then quickly, can we go through the diagnosis process of TB?
The first step in the diagnosis really is to hear out the patient's story. What symptoms they have, typically cough, fever, weight loss, fatigue, night sweats like Vivian mentioned. And so when this story is given to the health worker, then they go ahead with a number of tests. Typically for pulmonary TB, which is what is the most common, it would be sputum-based test, or that might also include a chest X-ray. You might also have a few other tests depending on whether you're a child. So if it's a child, it's more to hear the story of a child. Have they been in contact with somebody who has TB? Perform a chest X-ray. And you might have a request for other skin-based tests, blood-based test, or a stool test, which can help in the diagnosis of TB.
So Vivian, 2 months in, not taking drugs, then you decided, you know what, it's time.
Yeah, it's time because I was getting weaker kabisa.
Yeah.
So that is when I was just advised and maybe given some few nutrition food that were around. And that is what boosted me up, and I kept on going until I finished my duration, the 6 months treatment. Honestly speaking, I would skip some days, but I would be honest, going back to the facility and explaining back to the doctor, I skipped some days. Because you know, when you're starting the medication, there's a specific card you're being given.
Yes.
So you have to take each and every day. If you don't take, you have to put an X. So that is necessarily what I did. I was putting an X if I never took the medication.
Yeah. Why is it important, Daktari, to adhere to medication and take it every single day?
If you don't take your medication every day, chances of a poor outcome are higher.
Very high.
And also the chances of drug-resistant TB are higher. So whenever we treat any bacterial illness and we don't treat it adequately, either by giving a suboptimal treatment, so maybe the lower dose than the appropriate dose, or a shorter duration than the appropriate duration, chances of that particular bug that is in that patient transforming into a resistant bacteria increase. And so drug-resistant TB is a global problem. It's also a problem in Kenya. We have an estimated over 2,500 patients every year with drug-resistant TB, and we are also only able to get less than half of those. Yeah.
So then what happens to those days where a patient skips, right? What then happens? Does this elongate the period that they're supposed to be on treatment?
So if they skip treatment, basically it depends on how long that they have skipped treatment. If it's typically less than a month, they just pick up from where they left and they started, and they continue, but they have to finish the whole course really. If the period of interruption though is longer, then we have to reevaluate them, see whether they need to be restarted or so. And when you interrupt treatment for a long period, basically what happens is that the colonies of bacteria in your body re-emerge and they start dividing again. So it's basically like you've not been on treatment.
Yeah.
So then we have to restart your treatment all over. Yeah.
All right. And then so Vivian, for you were able to just stick to your medication throughout the entire 6 months. There may be changes that you had to make in terms of, you said you also had to make sure that you eat before you take your medication. Any other thing that you had to do just to make sure that, you know, the medication is working for you?
I had to set up an alarm actually.
Okay.
Yeah, and I brought a friend who is should I say a treatment buddy of mine. So like when it reached that time, if I forgot, they would call and ask me, hey, have you taken your medication? So at least they were there for me. Yeah, though at times, you know, when you don't have it, when you don't have that food to eat, it's also a challenge, though I would try. I would really try.
And then, Doctor, in terms of that management of, you know, drug-resistant TB, and of course also the measures that the National TB Program, of course together with, you know, other partners have taken to make sure that you reduce the TB burden in the country. Drug-sensitive
TB, I think Vivian has mentioned, she took treatment for 6 months. And drug-resistant TB, you would typically be taking treatment for at least 18 months, which is 1.5 years.
Yes.
So, and that's one of the reasons why when you have drug-susceptible TB, or the common form of TB, we really want you to take your medication properly, because if that fails and you end up developing drug-resistant TB, one, you have to take more medication, so more tablets.
Okay.
Yeah. And the period is 3 times the typical period you take to treat a drug-susceptible TB patient. In terms of what the National TB Program has done together with partners, I think there's a lot. The first thing that we really have to appreciate is that treatment for TB is free. Now, not just the treatment, but the diagnosis and treatment of TB is free in government facilities.
Okay.
And that removes a lot of access barriers for patients in terms of cost. So if you had to go to a facility every day and pay for those drugs every day for 18 months, say for drug-resistant TB, that would be a lot of money. And when we estimate the cost of those drugs, they come to over 2 million shillings. And other efforts that the government has put in place, you know, it's sensitizing the population through public campaigns, outreaches to the communities, to be able to just sensitize people to take up services. So I think we've made significant progress as a country, but there are some gaps which remain, particularly around finding the cases. So the appeal really is to everyone who knows anyone who has a cough or symptoms that are suggestive of TB, a cough, weight loss, night sweats, to urge them to seek these services in their nearest government facility.
And I think the call is because, again, TB is treatable.
Yes.
It's completely treatable. So that cases of stigma where you think TB, you think death, should not be there anymore. Okay, so Vivian, you went through the treatment process, I mean the entire 6 months of treatment. So during the 6 months, you said you had to go to hospital every 2 months just to make sure that everything is okay?
Yes, the only thing that kept me going was I was told after each and every 2 months there's this test that you have to go remove the sputum again, and it gets tested to see whether the medication is working or it's not working.
Okay then. And then as far as then improving of screening and prevention cases in the country, what would you say, where are we at? Are we seeing much progress where people just go for screening, or it's still work in progress?
So I think that is where we really need to up our game as a country in terms of screening and diagnosis. We miss over 40% of our TB cases every year.
Okay.
And a missed case means that that person is walking around in the community and probably transmitting to other people in the community. In terms of the long-term goal of TB control, that is really an obstacle to us achieving those goals. So I think every year we celebrate World TB Day around 24th March. So, and the theme for this year is to invest more in TB to save lives. So if we're going to invest in one area as a country, this would be one area we really need to invest in to find those cases.
Okay. And then for you, Vivian, as we close, you do a lot of advocacy as well. How is that going on?
Going to the society or the community to talk to them, it can be really challenging, because a person will ask you like, okay, what are you bringing? You're just bringing the talk, then what is in for us? Because they don't want to listen, but we keep on fighting. And I think, again, we should really sensitize the community, because I know through empowering them with that knowledge will help kick away the norms that people have about tuberculosis. Yes.
All right, and Dr. again, as far as the clarion call to the people, to the health facilities as well, as far as cases of misdiagnosis of the same, in like 10 seconds, what would you say?
I think I would like to reach out to the counties to invest more in terms of, one, allocating more resources to TB, and two, coordinating TB activities in their own counties, you know, have a bigger interest in controlling TB, understanding their local epidemic, working with their communities, and controlling TB in their own counties.
All right.
Yeah.
I like that. Dr. Stephen Wanjala, Public Health Specialist from Center for Health Solutions. Thank you very much, Dr. for your time today, as well as Vivian Faith, who is a TB advocate as well. Thank you for your time. And on that note, take a look at this health tip.
Now, so this is what we call the flat bench press. This one goes direct to your chest muscle, and this is how you do it. You lie down there, then hold it this wide, remove the bar, and bring it down to your chest and back. You go for those repetitions, 15 to 20. For the upper chest, use the incline bench. You lie there like that. Then from up, going down and back. On. Okay, this is the decline bench press. Also for the chest, you just lie there like that. So this one also you take it for 15, 20 counts, and then you go for 3 to 4 sets. This will help you burn the fats on your chest and also tone that muscle.
What an insightful discussion we had today on health diary and all about tuberculosis. And the takeaway message is, do not be afraid to go for TB screening, because this could save your life from dying from TB. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us. But if you have more questions as far as tuberculosis is concerned, feel free to interact with us on our social media handles. Until next time, adios. Now, while TB Day is usually celebrated every 24th day of March, with this year's theme, with this year's theme,